Good afternoon from Richmond Media to everyone around the globe. We want to specially welcome each and everyone to today's presentation on health issues from Richmond Media. It's indeed a blessed day, brightest day that the good Lord has given unto us. Beloved, if we indeed want to live a perfect life, then acquiring knowledge on our health issues is very, very important. Therefore, we thank the Most High God for yet another blessed day that He has given unto us. Beloved, without wasting much time, as we all know, today we are going to study different topic, and because we are human beings, we have blood vessels and the rest. It means this condition can apply to everyone. Today's topic is entitled Sickle Cell Disease and its Natural Treatment. Sickle Cell Disease and its Natural Treatment. To me, today is one of our medical missionary. She is indeed a blessing to everyone, including Richmond Media, our viewers and our listeners today. No other person than Dr. Nash. So we invite Dr. Nash to also join us today. So Dr. Nash, good afternoon.
Good afternoon, everyone out in Ghana. I'm happy to be here with you today, and it's a privilege to come on the platform and share with you, brother.
Yeah. Okay, we thank God. We thank God for honoring our invitation amidst your busy schedules for the children of God to also enjoy better way of acquiring health. So, Dr. Nash, today's presentation is about sickle cell disease. Our viewers and our listeners around the globe are ready. Some are having this condition. Some want to get knowledge about how to prevent themselves from this condition. And if we have it also, what are some of the things that we can do to be able to prevent complications? So the ball is in your court now, and our viewers and our listeners are ready for you on your presentation on sickle cell disease. Thank you.
Okay, you're welcome. All right, so sickle cell disease, as you mentioned, it is something that is facing a lot of individuals every day. And the thing is that it is really hard for some, especially when it runs within families. You may have not just one person, facing the situation, but multiple individuals. And understanding the nature of the condition and literally taking care of yourself can go a long way in helping individuals to be able to live with this condition. The thing is that it's in your blood. It's your blood situation that we're looking at. And even though you can do blood transfusion, that's not something that you could remove and like you cut a finger off and you get rid of it. And so understanding how to take care of yourself or some family member that has the condition is quite important, and also to support them and to help and to be compassionate with the challenge. And so I'm glad that we are educating the public, because you may have a friend, if it's not within your home, and so the knowledge can be very beneficial. Right. So we're also going to be looking at what is sickle cell disease, looking at the causes and the symptoms, and how you can alleviate some of these, and looking at some natural remedies. I want to sort of put your expectation up, that we sort of look at integrative health. So there is a place for medicine, there is a place for the medical doctors, there's a place for testing and diagnoses. And so we work integratively. So while we might be interested in what are some of the natural things that we can do, and that is fantastic, however, we also want to recognize that there is a place for some of these medical interventions that can help, especially when you have a crisis, or if it is that it causes organ damage, then you have additional things to look at now. Just trying to send an email off to you guys. Just give me 1 second. Okay. So just as a little background on myself, I'm hailing you all the way from Trinidad and Tobago, and that is a country out in the Caribbean. And so I also here own and have a lifestyle center, and you would see a picture of that when the slides come up. And at the lifestyle center, it's where we run programs, what we call our residential programs, and that typically would allow individuals to come and spend time with us in our at our facility. And so we help to take care of the folks and teach them how to live a nice, healthy life, and they're able to overcome their conditions. So coming to the Lifestyle Center, we're able to support you with a number of different types of therapies, not just the supplements and the herbs, but also teaching you how you can now go back home and live a healthy life. So let's delve into the topic, and when you guys actually find the slides, then you can share. But just as an overview, and I'm sure that we may have questions. And so, folks, if you do have questions, you can put them in the chat box wherever you may be streaming from, if that's allowed. So sickle cell disease is a blood disorder, and it is an inherited blood disorder, but you need the gene coming from both parents. And it's a lifelong situation that we're dealing with. And it is something that you are born with. So what is that sickle cell? We're looking at your red blood cells, and particularly that hemoglobin protein in your red blood cells that is not normal. All right, so you have some normal red blood hemoglobin, and you also have some abnormal hemoglobin protein. And so it's the abnormal hemoglobin protein that causes a change in the shape of your red blood cells. And what happens is that it becomes difficult with this changed shape to get through the channels of your blood vessels. So I think about a circular, tube or a circle, and trying to get a square through a circle. It's going to be pretty difficult. And so it may squish itself around to try to get through, but in so doing, it can cause you a lot of pain and discomfort. and then the blood is not going to flow as well as it should. So here you have a situation where it would be even a greater problem when you come to your smaller blood vessels, your capillaries. And so you find that the sickle shape of the sickle cell, and if you think of like a crescent moon shape, so it has that shape, a crescent shape, and that it makes it difficult for the blood cell to pass through, as well as they tend to clump together, and so it's bulky. Now, there's certain categories of individuals who might be affected or more likely to have sickle cell disease, such as Africans, Black American ancestry, Arabs, the Greeks, the Italians, the Latinos, the Native Americans. They tend to have that's more common in their communities. And so what you find is that because you are having less of your normal red blood cells, you now can run into that red blood cell as a deficiency, and thereby you are termed to be anemic due to sickle cell. And so doctors can diagnose you with different tests. You find that individuals are more likely to get infections, and then there is stem cell that's offering some relief for individuals. And so we will go into a little bit of detail as to sickle cell full-blown and sickle cell trait, because I'm sure that you might have heard some individuals having the sickle cell trait. Knowing your status is hugely important because then it helps you to relate to your body's needs. So if someone has a sickle cell trait, they don't get the sort of symptoms like someone who has full-blown sickle cell disease. And so that means that they are like a carrier. And so they have a gene, one of the gene. Sometimes, so what it requires for you to be full-blown is that you get the gene from both parents. And therefore, it's a sort of flag where if you know that you have the sickle cell trait, then pray to God that you do not find a sickle cell trait partner, because then now your children could be at risk, having a 50% risk of getting full-blown sickle cell, or a 25% risk of getting sickle cell, and as well as you may have a child, and it's a slim chance that that child would not have it. However, you want to be able to have a pregnancy with ease, or even to have a family that doesn't have such a situation to deal with, because it is for a long-term run. All right, so just checking. I'm not sure if you have the slides yet, if that's possible, or if I can share. It's just typically notes anyway, so I'll go on to continue to speak. So there are some complications when individuals have sickle cell disease. What makes their life sort of difficult? And so it is that you, as I mentioned earlier, you can have a low blood count, and that's anemia that you're looking at. And so you do not have sufficient red blood cells to meet the needs of the body adequately. And therefore, you would find limited capacity of certain organs. People tend to feel fatigue and so forth. You may see individuals it might be affecting their liver, and so they're more likely to get yellow eyes and jaundice, yellow skin, yellow eyes. It can also affect your gallbladder. Let's just see. Yeah, some other complications. Your bone could become painful. You can have a pain crisis in your joints and in your bones. It's just aching. Individuals may have a stroke. And so if it is that your sickle cells sort of clump together, they can form clots. And that could be in your brain. And so it can form a stroke. What about the heart? Individuals tend to suffer from an enlarged heart because the blood cells need to pass through there. But the heart really has to work harder to push this abnormal shaped cell around. And heart failure can be a result. Your kidneys, you may suffer kidney disease and kidney pain. Your lower back may be quite aching. And then you have your lungs, where you have acute chest syndrome. And you also have uh, priapism, which is a long, painful erection that you don't have a control of. And then you find that there's a skin condition, chronic skin sores may break out. Your spleen could become shrunken and increase the risk of certain infections, because your spleen is part of your immune system and that helps to fight off bacteria. So you'll find it's very important for individuals with sickle cell anemia, even like our children who would interact freely with other children in society, that you need to really guard them, watch them, so that they don't pick up infections, because then they have a situation. So if you have someone with sickle cell disease and they're running a fever, you know that they have an infection, take it seriously. You need to address that as soon as possible to bring that body well again. And then the eyes could be impacted, and so the vision. And then you can also have aplastic crisis, which is where your bone marrow suddenly stops making red blood cells, and that can make your anemia even worse. So those are some of the real hard medical complications that can face individuals. And but not it doesn't happen to everyone at once, or some of these situations may not even be an experience for certain individuals. So everyone is different, and how it plays itself out in the body varies. So just a little bit about explaining the difference between a normal hemoglobin in the red blood cells, as well as an abnormal state. And just to flag that there are different types of sickle cells. So you have hemoglobin A, where it's normal. And so your cells are like a donut shape with a little sink in the middle. And then that is nice. It moves through your body easily. However, with the sickle, it's called hemoglobin S. And so the S stands for the sickle, and it has that crescent shape. Now, the normal red blood cells can live for how long? About 120 days before it's replaced. A sickle cell hemoglobin, those red blood cells where you have the hemoglobin S in them, those red blood cells can last for 16 days, 1/6. And hence you find that is a big problem, because now your body has to keep replenishing cells. So if you can do something to help to build red blood cells, like taking chlorophyll I love Corella is like a number one go-to to help to replenish your red blood cells. And there are other things that you can help to build up your red blood cells, and we'll share that with you towards the end. That can help a long way in a sickle cell situation, so that you keep replenishing your red blood cell supply. Now, it's important to note that not all of your cells come out and are created sickle. You will have some normal red blood cells, but you would also have some abnormal ones. Okay. So, yeah, so there is also another type. So you have the hemoglobin A, you have the hemoglobin S, then there's hemoglobin SS, hemoglobin SC, you have beta plus thalassemia and beta zero thalassemia. Thalassemia is really where you have this inherited disorder of a gene in the red blood cells that result in the impaired ability to produce hemoglobin. And that scares a lot of folks. So you're not even producing hemoglobin. And so then there are other types, hemoglobin C, D, and E. So speak to your physician when they do tests to find out what type you have and what are the concerns around those, so that you can be very specific with partnering with your healthcare provider, with your plan of care. And again, stressing on the importance to understand your type, because that will guide you as to the cautions that you need to take and help you to experience a better quality of life. So I'm not sure if you have any questions yet from what has been shared thus far.
No, but we have comments that Sister Christiana Sapon said, "Good day, sister. Nice topic." So most of our viewers and our listeners are really enjoying. I hope by the end of the lesson, their question submission will also follow. Thank you.
Okay. All right, good. So you can go to the next slide. I saw you got it up. Fantastic. And then let's go on now to the symptoms. Okay. So people who have sickle cell disease, so like we mentioned, anemia, and for anyone, anemia, it just means, lower blood availability. We wouldn't say the absence of blood, because there is, but just at a low value. And so people would usually feel fatigue, and they will have pale skin. You can just stretch under the eye and you see it all white and pale. And that happens a lot for our ladies, especially as they lose blood due to their menstrual cycle. I would also say during that time, try to build back your red blood cells, making sure you have green drinks that can help you with getting that chlorophyll that you need, using things like blackstrap molasses. It can help. Prune juice, the raisins, those things tend to help you to build back your blood supply. But for our ladies, especially during the menstrual time. And then if you have a sickle cell situation going on, you certainly need to be doing that more regularly. Now, you also have other symptoms that can lead to disability and even death if you don't take it seriously and get the medical attention that you need urgently. So individuals can go into a sickle cell crisis. Okay, we have that coming up. But usually you have the pain in your abdomen region. You have pain in your back. You have pain in your long bones, like your arms, your legs. You may be running a fever or even throwing up. Vomiting is not normal. All right. And then there's so many different reasons as to why individuals may throw up their food. So pause, if that's happening to you too regularly, that's an indicator that something is going on. If it happens once in a blue moon, once in a while, then okay, maybe you did like me. The other day, I went walking and with my niece, we ended up in the park, and I joined her in swinging, and I had my eyes closed, just in feeling the breeze on my face. And she said, "Auntie, don't do that." But I didn't listen to my 2.5-year-old niece, and I should have. It just made me feel upset, and I threw up a couple minutes afterward. So as long as you're not doing crazy things like that, but you're find that you throw up quite a lot, find out, go get tested, see what's going on. It could be a kidney issue, a liver problem, find out what's going on. And then you have sickle cell crisis, some more things. You can also do things that can help to keep your oxygen levels at a good B. But if it is that you do activity that can cause a demand of for oxygen in your body, like you do strenuous exercises, you're running a marathon, you're doing things like mountain climbing, like hiking, and you're going to altitudes where you're more likely to get less oxygen availability, flying high at altitudes, which can deplete the availability of oxygen. So taking long flights, and also any other illness that can cause you to be low on your breath, having COPD, chronic obstructive pulmonary disorder, any of those things that place a demand on your body or that decreases oxygen can put you into a crisis. So you want to, part of your plan of care is to really care for what you do, what you engage in, so that you don't run in a demand for more oxygen because you don't have much to give because of the sicker shape of your cells that's roaming around. Okay, so acute chest syndrome usually occurs in children where they have this pain in the chest, and it's basically because there is poor blood flow within the lungs and the heart region. And therefore, you find that they may have difficulty breathing. Take those things seriously. They do need oxygen. Rush to the emergency room. Now, sickle cell test and screening. You can work with your doctor to find out. Now, by the time individuals are adults, it's very likely that they will be well in the know about their sickle cell condition. So if you're having babies, you want to make sure that they get tested to see if they also have the sickle cell trait, or if it is that they have sickle cell disease in its entirety. So it's a blood test, and you're looking to screen the younger ones. If you have brothers, sisters, somebody finds out, others within the home should go and find out what their status is. It's better to know, because then you can help to take good care of yourselves. So the newborn babies, soon after birth, they will be screened. And then you have carrier screening, where doctors can test you and your partner before you have a baby, to see if you would be having a baby that would be at risk of getting sickle cell disease. And it might seem quite bold if you meet someone and you're interested in that person, but it can also, if you marry someone, you're in the run for the lifelong, to be working with this situation. So have that person tested so that you know what you have on your hand, and how you can help to take care of your loved one who may have this condition. Individuals with sickle cell disease do lead normal lives. They work, they have fun, they have friends, they laugh, they have family. Yeah, they do things, and so we should not exclude individuals or discriminate in any way, but knowing would just help you to be more supportive. And so we have sickle cell crisis. Just wanted to little heads up again, because we talk about a crisis. If you do have a crisis going on where you have the pain, or you have shortness of breath and so forth, what you would find when you go to the emergency room is that they would administer fluids to your vein, sort of to hydrate the body. You also have pain medication that might be given to alleviate that pain. And when the pain is alleviated, then your whole nervous system calms down and you're able to take better breaths and get more oxygen within your body. Working to do using natural means of relieving pain may be helpful. But you would know if you do try it 1-2 times and it's not effective, you may need to use something stronger. Then blood transfusions will be part of it. We talk a little bit about that shortly. And then making sure that you get oxygen. They may literally have to administer oxygen to you. And of course, whatever might be the effect of your crisis, that would need to be addressed. So if it's an infection, you find that antibiotics may be offered to help to fight that infection. So let's look at the plan of care. And so when not just with that background, how do you take care of yourself? Prevent the crisis situations, meaning you're not gonna take hikes in high mountain area because you know that you have a need for oxygen, and therefore the altitudes, the more you go up, the air is thinner, the oxygen is thinner, and so you can go into something hypoxia, and that's not going to be fun. You would have problems in breathing. So prevent the crisis situation. Try and prevent getting an infection. If keeping your immune system up. But if you go around an area where folks have the flu and other kinds of infections, hey, wear a mask, stay away, extend that caution. All right. And look at the anemia situation, keeping your red blood cells going for you. The more you can help your body to make more red blood cells, it would be good, because sometimes individuals without such efforts will be in need of a blood transfusion. And therefore, you have to take somebody else's blood in. And that comes with additional challenges. So if you can make your own red blood cells, then that would be good. You also want to look at whatever symptoms you're having and address that, whether it's pain, whether it's fever, a headache, whatever. And more than that, I mean, those are mild. What if it starts already to impact certain organs and you have the kidney issues or a liver situation, then you'd know you'd need to address those. But basically, you want to look at adding folic acid as a supplement. We have 800 micrograms for an average adult. And you can also get folic acid in your food. So try to have these foods quite regularly. You have mung bean, chickpea, lentils, spinach, kelp, which is a seaweed vegetable, lettuce, asparagus, red beets, okra, walnuts, whole grains, oranges, strawberries, just to name a few. And so if you're eating those foods, you're getting folic acid in those foods, and it helps to make new red blood cells too. You also want to increase your B6 And so B6 as a supplement, 100 milligrams twice daily. And you can have foods such as your bran, whole grains, garlic, spirulina, excellent in B6. We also have, let me see here, sesame seeds, blackstrap molasses. So these are things that you should have in your home quite regularly. Avocado, pear, cauliflower, all of those, you get great source of B6. Then you also have zinc, and it's 20 milligrams of zinc. I love pumpkin seeds for getting a zinc supply. And this 20 milligrams daily, it's a sort of small amount. So just taking one handful of pumpkin seeds twice a day, that can be sufficient for you. And then you also have vitamin E, and it's 400 international units of vitamin E twice daily. Drinking water is hugely important because water helps to increase blood flow throughout the body and make your blood more fluid. And so as you drink water, you will be able to help move your blood around. The medicines, quote unquote, because do have your medicines on standby for your emergency time of need. Have that candid discussion with your doctor as to the purpose for your medication, and so that at least you can be that first response when you have a situation going on, if you understand why you need or why the medication was given to you. Now, another thing to look at, so we talk about the activities here, doctor. All right, so let's go on. Watch the little children because they may not always be able to explain themselves. And so just having a careful eye over them will be helpful in helping them to deal with their situations. They may more cry, I don't feel good, or sometimes they're quite, they may not be well and they're running about. Calm them down. You don't want them to run out of breath. There's also the anemia that can take place with children, so help them to keep their blood up. So there are a couple little pointers again on the treatment line. You find one, make sure you're diagnosed early, having penicillin as a prophylactic. Even when it comes to pneumonia type situations, you don't want to allow that to perpetuate. Have folic acid supplementation, even for the younger ones. Talk to the pediatrician to see what you can do to take care of your young children. Then the blood transfusions. This is also an option that's offered often enough, but you don't want to have too many blood transfusions. If it's needed, then you take it to save the life. But some of the complications with the blood transfusions is that when they're done regularly, you find that it could accumulate iron within your body, and that iron load can reach to a toxic level. And so you want to be able to monitor that in the healthcare facility. And there are different things that they can give you to sort of eliminate that iron overload situation going on. But for individuals, who do have sickle cell disease and their blood count is low and there is a need for blood transfusion, they certainly appreciate individuals who donate blood. So if you're one where you're a blood donor, continue to do so, because the world needs you for several reasons. And even in a sickle cell disease situation, the world needs. We're told that if one person gives blood, it can help to share for about 3 individuals who have sickle cell disease. and they are very much appreciative to get that. When they get that blood from you, it comes with a nice rounded red blood cells, and so they get relief from their pain. They're able to breathe better. They don't have some of the issues that in a crisis situation because they have nice, wholesome blood. But that's not going to last out forever. And so their body will still be challenged with the sickle cells that would be coming in and made. So you Yep. So basically, there's one other form of treatment that is given, and it's a particular drug called hydroxyurea, and it tends to make your red blood cells a little bit more plump. And when that happens, you find that it will move, the blood will move around through the body, and folks would get relief in that situation. However, that's a medication. But what the research shows is that there's a natural alternative, and that is resveratrol. So resveratrol, that comes from the red grapes, and it's a nice compound. And there's a study that shows approximately 900 milligrams per deciliter daily of resveratrol could be a substitute for hydroxyurea, and make your cells nice and whole, and it would drive more of that wholesome blood cell production, and therefore you find that individuals could have a better experience. So basically, it's if you have high, sickle cell anemia, it really is like living your life, and having done your days so many times, knowing what you can and what your limitations are, then it would, by observing that and taking caution, can help you to lead a meaningful life. Like I said, it's not the end of once you have a diagnosis of sickle cell. Folks do live with it for quite a long time. But there is just a knowledge of care that I need to take care of myself. Go back to those foods and try and have those foods. I also want to encourage, so we talk about the food items that would be highlighted, but a total plant diet can be quite beneficial to maintaining healthy body tissues and organ cells and tissues. So a total plant diet will work really well for you, because there you get folic acid, there you're going to get a B6, and you will have protein in it as well. That's going to help. And then you also have your nuts and your seeds included in that plant diet. It's not just a snack, it's food. So when I talk about a pumpkin seeds, sunflower seeds, sesame seeds, walnuts, all of those, eat them on a daily basis. A handful at the end of breakfast and the end of lunch will be fantastic. We also want to make sure that while you're exercising, not in any vigorous way, but simply taking your walks will help you to take deeper breaths and get more oxygen in your body as you take those deep breaths daily. So nice, cool, calm walks is going to be helpful. On a flat surface, even better. Then making sure you get sleep, your rest at night. That's going to go a long way, because you give your body a chance to repair its cells. You give a chance for the body to even make new red blood cells when you're rested. Okay, so you're not using up too much of your reserves, but you're focused more on making that, that's when the body has the healing going on at nighttime when you're sleeping. It's like a little operation that takes place in the body. Then you also want to make sure that you get sunlight. A lot of folks, can be sunlight deficient. And again, managing total health and preventing certain situations from going on. Getting our sunlight will be quite important. Every cell needs it. It will make your good red blood cells more robust to be able to help them to do their work in a more faithful way. So doing all those things, and then we talked about a water, plain nice water, lots of it, and trusting in God. Those things can help. Uh, when you do all that you can humanly, God is still there for you to be able to help in this your time of need. So those are some of the key pointers and takeaway for looking at the sickle cell disease topic.
Okay, God bless you. So, our viewers and our cherished listeners, by God's grace, we've been able to adapt and gain a lot of knowledge from Dr. Nash, who is a naturopathic doctor, but she was able to blend all the aspects in terms of healing, both from all the other angles, areas that can contribute to our way of maintaining a healthy blood. And even if we are having the sickling cells, how the crisis will be minimized. Dr. Nash, God bless you for this knowledge. Some question came. Someone is asking that there is a myth out there that once you give birth to a child with sickle cell, they you will not grow old. Few years or at the early stage, the person might not survive for long. What's your take on that as this presentation is concerned?
Yeah, that's a okay. So the person asked about whether it's a myth. It is a challenge if someone has the sickle cell disease, a baby. So there is where the care comes in, to making sure that you're really taking care of that child. If there's an infection, that you address it as soon as possible. So an indicator of an infection would be like a fever, for example. So there is where you find the risk comes in with the quality of care that may be administered or not administered at all. And so the person suffers and then they can die. If there is pain in the chest area, then it could be the lungs that needs oxygen. And so if you don't go to the emergency room to have oxygen administered, or to even alleviate, maybe get a blood transfusion in time for whatever symptom might be experienced, so that you get some nice wholesome blood cells that can hold oxygen. There is where you find the breakdown comes and individuals may die too early. So it's something to be informed about. I have sickle cell disease. These are the possible complications we showed in a list. It affects the brain, the kidney, the liver, the lungs, the heart, your bones. So these are the risks. This is what it means. If I have jaundice, when it affects the heart, it can lead to heart failure. So if it's not addressed early enough, those symptoms that you see, having working with your physicians to have that plan of care. And that's why I started off to say it's a serious situation, and we have integrative approach to the care plan. So it's nice to want to do all things natural, and certainly continue to do that 100% at your home. However, if you do run into a crisis situation, you're getting some impact on the body, then seek medical attention so that they can run tests and identify what exactly is going on with you and help you to come out of that crisis. If you don't need to take medicines to come out of a crisis situation, take it. And then you continue to live the nice, healthy life with taking resveratrol and the B6 and the folic acid foods and all of those things, so that you could survive.
Okay, thank you. Auntie Patricia Cole said, hello, good morning. Then she asked a question that I have sickle cell disease. I am 56 years old. I've been living with this debilitating illness. Would like to get this address. Or she's asking about how she will be able to get your address. I don't know if she's also living in Trinidad, so you can mention your address so she can follow up on your wellness center. Thank you.
Okay, she need to be a little bit more clear. Because to get this address could mean also to get the
Yeah,
situation addressed. So let's put a little bit more detail, Miss
exactly.
Patricia. Yeah.
Okay, so I think then, but Auntie Patricia Co, if you contact Richmond Media Health Issues, if you contact us, we will be able to link you to Dr. Nash. Then we will take a detailed assessment so that we will give you the best treatment out of that. I hope that's clear, right? Doc, I think the last question someone is asking, in your presentation, you mentioned about sickle cell and stroke as another, yeah, sickle cell linkage with stroke. Can you please elaborate the linkage between a sickle cell and stroke?
Yes. So a stroke is a situation that happens in the brain, all right, where blood is cut off from a certain portion of your brain. And so the body is hit with that, and any part of the body that brain was responsible for addressing, then you find that part of the body could now become debilitated. So that can be caused where the blood supply is cut off due to a blood clot, or if it is that there is like a high blood pressure situation going on and the blood vessel burst in your brain, then you have a hemorrhagic stroke. So the blood is all over, and that one usually people can bleed out and die, because it keeps breaking down different parts of the body, not getting the blood supply. But if you do have a blood clot in the brain, that is termed a stroke. So the thing is with the sickle cell, it will be, it's in the bloodstream. So it's going to move all over through your body. And any area where there is a difficulty for that shape to go through because the blood vessel might be quite small, then it's going to give a little resistance to put through. And so there you find the heart might be pumping harder to send it through. But then these sickle shaped cells also tend to clump together, and they can formulate little clots in the system. And if that clot is formed in the brain, bloodstream of the brain, then you have a blockage taking place. And certain part of your brain may not get blood supply, thereby no oxygen, and that is what would lead to you having a stroke. So that's a stroke for you. As long as you don't get that blood supply, you have a clot, and the blood supply isn't going to that portion of the brain.
Okay, thank you. Thank you very much. So, one of our viewer is saying that she has really enjoyed the lesson. And as you just entered into the stroke lesson, she might love if your next coming to Richmond Media Health Issues, you will come and just explain or teach us or take us through the topic stroke. What is your take to our viewer?
Well, viewer, need to get you to extend an invitation.
Yeah. Okay. So
Well,
and then to our cherished viewer who placed this request, Dr. Nash is always available, and we will plan with her again. And at her free time, she will take us through this topic, that pending topic, stroke. Dr. Nash, God bless you for your time. So at this moment, we will just give you the time. Take home to our viewers and our listeners. What should we take home as we are bringing today's lesson to a close?
okay. Yeah, so your takeaway points, you have sickle cell disease, you're living with it, is to number one, self-care. take care of yourself, or if you have younger ones under your care, taking care of them, having a watchful eye over them, understanding and appreciating what your limitations are. It is better to be alive than to go do these risky situations that would cause you to run out of breath, that would cause you to get a cut, and you start losing blood when you need to keep some of that blood in. So once you do that, then secondly, part of taking care of yourself is making sure you eat those foods that would be supportive to providing the zinc, the folic acid, the B6, to help build your blood. As I mentioned, there are things I love, spirulina, chlorella, that would be really good in helping to rebuild new blood cells. Blackstrap molasses, excellent. And then thirdly, it would mean also working closely with your physician, knowing what to do when you have a crisis, knowing how to identify when a crisis hits, and then what is your next step? What do you do? Don't try to handle things on your own. Really seek medical attention so that you can get their intervention, as well as given some guidance as to what you can continue to go back home and to watch for and to do. So it is a serious condition. Don't take it for granted and lay back on it. Be quite proactive, but also be in a ready state that you can be reactive should you hit a crisis and anything happens. Know too that life, you can have fun, you can laugh, you can play, you can enjoy life, and that your life can continue. It doesn't need to be cut short, but the care that you put in will go a long way into the quality of life that you lead.
Viewers and our listeners, our viewers and our listeners keep saying God bless you. Auntie Comfort Abali said, I'm interested in the topic on stroke as well. Thank you, Dr. Nash. God bless you. Sister Christiana Sapon said, God bless you, Sister Nash, for this important lesson. So we all, together with our viewers and our listeners across the world, we are saying that we appreciate your time amidst your busy schedule. You have given time for God's people to be able to get this in-depth knowledge, not only at one corner, but across the world. So we thank you and appreciate your time, your energy, everything. But we know that this will not be our last meeting, as the requests have been. So we will be communicating and know your free time so that we can bring you on board to our cherished viewers. God bless you for your time. Okay, so to our viewers and our listeners, we thank you for your time, your energy, your bundles and everything, your comments and everything. We appreciate them. But we are saying that it's timely we do things. But it's time. So same time next week on Richmond Media Health Issues. Bye-bye for now.